did it. But sometimes before you go in for surgery, which is very invasive.
Yes, and dangerous also some. I mean, there's an element of risk.
There's risk involved. Eliminate and do everything possible that is less invasive before you go for the big one.
Hey everybody, my name is Angie Murenga. You're watching Just Angie. It's Lifestyle Thursday, and today is the third and final part of a conversation that I've been having with Dr. Immaculate. She's a chiropractor, and we've been discussing all things around chiropractic. So I was asking, how does someone know? Because you said yes. I think you said, how does someone know that they need to come to see a chiropractor? But you had said it's like taking the car to service. But even somebody watching like right now, what is it that they would be feeling that they would need to come to a chiropractor? But I guess for me, I can answer one part is if you're 50 and you've never been to one, you need to go see one. Or, or whatever age you are, even 30, 20, you need to go see one because your body needs to be almost recalibrated back into alignment. But what would you say?
Most of the times, those who will look for us are those who already have suffering from something.
But we don't want to get there.
So for them, if you already are at the point of back pain, neck pain, shoulders, and you just feel migraines, and you're feeling of numbness, tingling, the body is just not behaving, and the body is not behaving right. Also, you're not sleeping. People take sleeping for granted.
I slept completely.
And sometimes we imagine we are sleeping, but we are not really sleeping to rest.
How was that shock on me? Because I'm a sleeper. Me, I don't waste time. Sleeping is sleeping. Inside the bed, out. But after the session, there was another level of sleep.
So if you're finding you're not sleeping, you're finding you're worried, you find all the time maybe you have to stand in a strange position so that you feel well, you are off, should I say your chassis is off. So you need it to be aligned. Now that's if you're already suffering something. A lot of people who have been told disc problems.
Yes, they should first come and check.
Come and see.
Before you start having operations.
Yes.
Come and check whether that disc can be put back into alignment.
In fact, one thing, Angie, is that surgery, sometimes many people have had surgery for their spine, neck, back, name it, done, which definitely the doctors thought it was necessary to do, and so they did it. But sometimes before you go in for surgery, which is very invasive.
Yes, and dangerous also some. I mean, there's an element of risk.
There's risk involved. Eliminate and do everything possible that is less invasive before you go for the big one. Because there's some patients I've told, this one, just go for it. Yes. But there's some I say, wait first, let's see what we can do before you go under the knife.
Yes.
So sometimes try something less invasive. I say, do everything. Even some I say, even drink marubaine first before you go for the knife.
Yes.
Because that's very invasive.
Yes.
And so chiropractic can help in such conditions. Now, for those who are you have no symptoms, no nothing. Just because you use your body every day, you sit in our jam every day, you are
Let me tell you where else they sit.
Yes.
Sorry. It's on these computers. You see now everybody's on let's say Zoom, Google, Microsoft Teams, whatever. People are all, it's a laptop and you're always at it. That definitely, because also, there's the migraines because of voice checking the screen, but the posture, the fact that you're sitting like that also must mean that you need to get this body aligned.
Something is getting off. In fact, as you talk of the laptop and the screens, let me say the demon that is the worst is the phone.
Really?
The phone.
Dr. Immaculate, okay. Why the phone?
Let's put it this way. The smaller the gadget, the worse it is.
Really?
Oh, yes. So we find even the children are on it. You see, if you have your cell phone, this is you, this is you, over a period of time. So you're just your posture already, because you're going to accommodate to do whatever with your body you need to do to be able to zoom in into this thing. So the smaller it is, the worse. The laptop is smaller than the normal desktop. So the more we've gone into smaller, the more our bodies are actually getting injured and hurting in the process. So what do we need to do? Because these are things we are using today. We can't say we are not going to use cell phones, we won't use our laptops, we won't use our iPads and all these things. Take care of yourself as you use these gadgets. Every so often, once every 3 months, come on in. There might be no pain. Let's check, because we are trained to check, to analyze the body, locate where you have these misalignments and correct them, so that your body can continue to express itself and to do what it needs to do in the most effective ways. Remember, we are talking about effective living.
Yes.
Efficient living, full expression of your body to do what it needs to do. I want you to be able to fully turn your neck to reverse, not the whole body. You know, people reverse using the whole body. You should just turn your neck and be able to see. But because we are doing that and we are not realizing maybe there's something wrong in my neck that's making me not move fully the way the joint is supposed to move. So just because of our lifestyle, you need to see a chiropractor.
Yeah, definitely.
Pregnancy, that one now, that's close to my heart.
Really?
When it talks about pregnancy.
Yeah, by the way, congratulations, you just had a baby. I didn't even know. I was like, to be Dr. Immaculate. I didn't see your baby, but anyway.
Thank you. Pregnant women, pregnancy is a time our woman's body goes through so many changes.
I was gonna say as
and
well.
you see this is the normal stance for pregnant women, particularly towards the end.
And then standing like this.
Standing like this.
And then you see you can't sleep.
You can't sleep. Things are happening here. Things are happening everywhere. That it's a beautiful moment.
It is, but it's
you
very
need
stressful.
A pregnant woman needs chiropractic care.
Really?
Yes, it helps make pregnancy
And will
better.
you do it on my side? Because you see now when I come and I'm thinking about your bed, will I be able to do it on my stomach?
The tables can be worked in such a way to accommodate a pregnant woman even when she is 9 months.
Really?
Yes, we do adjust women, and we adjust. In fact, I always say, if you know your due date, come that week before, or even a day before, even on the morning before.
Really?
Yes.
It helps?
Do you know, if you're well aligned, particularly in your pelvis?
Yeah, because you made
you'll
pressed
open
and you said,
up better.
the pelvis is missing. I was like, the pelvis?
Yes.
Then you went pressing things aligned, I guess.
That's the route for the baby to come through. If it's in better alignment, you'll open up better.
Oh, yes.
And
definitely.
close back better. And actually, before you deliver and more so after. Because you see, for delivery, what happens? Things have to open up. You know, particularly for the pelvis, it has to open up so that this baby can come out into the world. And when it comes back, it can come back in line. Wonderful. It can come back off. So after you have delivered, come and let us align that again. Yes.
Yeah, because I heard you that day saying you're aligning my pelvis.
Yes, so pregnancy is definitely a time that we need.
That's a good one.
Another one, if you sit in the office for a long time.
Yes, or at home,
or
on your
at
chair.
home, drivers, long distance drivers. That one is a lot of impact on the lower back, shoulders and neck. You need a chiropractor. So children, you'd imagine, why would I need to see children?
Really?
We are just children. Yes, children need to have their spine aligned. Particularly them also because they are active. They will fall and not tell you I fell.
That's true.
Boys will fall, wake up, shake it off and move on. Who told you maybe they didn't move out something?
Something moved out.
So for children, it's good to also let them grow up with their spines being in good alignment. Some problems are arrested. Start off even, let me shock you, the birth process.
When the child is being birthed.
Yes. The birthing process is a beautiful process, but it can be very traumatizing to the child because remember, they have to turn this little head and yank this person out. In that process, those bones do move out. So we also adjust infants. We take care of babies.
Wow.
So, yes.
Amen. And there's something I was thinking, something that you told me that day after many discussions, which I think is true, that at some point, I think that's true, we've learned to live with pain. Because that's what you said. Some things you ask and I think, but it's just the way things are.
But why should you live in pain?
I know, but I just never thought about it. But I think it's a very profound point that the ones also need it. If you've learned to live with a pain, and you're just like, okay, this is just a pain. I
Yes.
think you need to go see a chiropractor.
You're very right.
Because we've learned to just live with certain things that have happened, and the body is also aging, and just allowing ourselves. Remember, for me, was because I'd broken my ankle bone many years ago. I can't remember how many now. But when you came, you could tell. And you sort of, me, I was just used to it. I was like, the thing healed, and they were trying to get me to go to surgery. I refused. And I said, the caveman days, bones used to heal, this one will heal. So I didn't, but so I was used to it. And my daughter would tell me there are moments that I would limp, but it was even subconscious. And then also, I think another thing that came out for me, as I always tell my secrets here, everything, but I was overusing one side of the body, then the other one, because of the break. So because I was already used to it, I was used to crutches. So even if you've broken a bone or you've been injured before, even if it's healed, you need to go check it with a chiropractor. Because it's now something that happens subconsciously.
You're not aware that
you're not aware that you're doing it. Yeah.
Even when people are not aware that one leg is shorter
than the other.
Many people, I would not be shocked if you were to put 90% of the people, there is some form of misalignment somewhere that they're not aware of. When you look at people walking and one, look at them properly, one shoulder is higher than the other one. That person is off balance. You need to have your shoulders level, hips level. That helps now for the weight to be evenly distributed on the body. And it's not, when you know, in fact, there's this one that I hear when they say it's because of my weight that my back is hurting. Not necessarily. Because if you're well aligned and your body knows how to carry your weight, your back should not then be a problem. Otherwise, all the nice mamas we see in the market who have got a bigger structure, then they should all be complaining, but many of them don't complain
about the back problem. Amen. I really like that. So we'll definitely give you their contacts, because also I think because of the COVID-19 and the coronavirus, I think you're seeing less patients and being more careful, which is good. So I love the fact that Dr. Immaculate will see you by appointment. So she will, her contacts will be on the screen. So you can call her and set up an appointment, or call up her clinic and set up an appointment. But you definitely, this is a gift. You don't want to give yourself a gift. This is a gift you need to give yourself. And she did not, this is not advertising. She did not tell me to say that, but it's because of the experience that I had that I wanted other people to have the same kind of experience.
I would be, maybe before we close, I'd like to just to say one thing. You are created to be able to use this body to be able to do the things God made you to do. And it doesn't matter if you're an athlete, you're a banker, you're a who. This is the vehicle God has put so that you can interact with earth to be able to do his purposes. Take care of it.
That's true.
And take care of that spine. And we are there to take care of that. That's what we are trained to do, and that's what I love to do. I want to take care of people so that they can go and shine and do what they were made to do. Yes.
Amen. And as we conclude, I was just thinking, something dropped in my spirit. It's even, you know how people, we're so busy, we don't have a moment in the day. This is a good moment, because the sessions are like 1 hour or half an hour. This is time out. This is now forced time out. You know, when you say, I can't find a moment, this is, you can go to to the clinic, lie on the bed, you call it a bed or something. What do you call it? A table. And just black out and forget about the world and let her treat you. I think it's important as well, because we need to find pockets of time where we can relax. And I wanted to say as well, what fascinated me about Dr. Immaculate was that I do marketplace ministry. That's what I do. And I've seen many people practice their trade in the marketplace, but yours was also very profound. That you're actually taking a gift that God has given you, and using it in the marketplace to make people better. And I thought that was so powerful. And that's what we do on Lifestyle Thursday.
Amen. Wonderful.
Amen.
Yes.
Amen. So please contact Dr. Immaculate. Give yourself a gift. Align your body, align your posture, and so that we can be able to do more and do it for much longer.
Yes.
God bless you. Thank you so much for watching Just Angie.
Thank you.
Thank you so much for coming.
I enjoyed myself.
Thank you.